Good morning, everyone. My topic is about fever. Introduction. Viral fever is a group of infections inside the body, generally implicated by high body temperature, sore throat, headaches, burning sensation in the eyes, body pain, and some vomiting. A viral fever can affect any part of the body, and during the fertility window, it can also impact your potential to convince. It's very common in babies, small children, and old people as they have low immunity, and less common in case of young couples. In viral fever, the immune system fights with virus and burns them so that the body temperature is raised from the normal range. Sometimes it may happen with many couples that infertility can cause more frustration and depression in a couple. Infertility specialists are called gynecologists who have been specially trained in the advanced techniques in assisting reproduction in infertility and subfertile couples and provides best fever. Pyrexia is an elevation of body temperature above the normal circadian range and a daily variation as a result of a change in the thermoregulatory center located in the anterior hypothalamus and preoptic area and increased in the hypothalamic set point of 37 degrees. Next, due to infections, metabolic disarrangements, or increased cell destruction. Next, dengue fever. Dengue fever is a mosquito borne viral infection prevalent in tropical and subtropical regions. Children are particularly unviable to serve complications. This presentation aims to help identify and understand the symptoms of dengue in children. Classification of fever. There are three types of classification: fever with localized signs, fever without localized signs, fever of unknown origin. First one, fever with localized signs, form the majority of feeble episodes. Associated signs of localized infections, therefore, heat swelling, discharge at ears, nose, skin, throat, cough, vomiting, diarrhea, rashes. Next, fever without localized signs, presence of elevated temperature for less than 1 week. Careful history and examination fails to reveal cause. Suggestive of consult cause or predominance. Fever of unknown origin. Presence of elevated temperature for less than 1 week without localized signs. HS exam and preliminary investigations fail to reveal cause. Infection may eventually become apparent. Similarly, 20% no cause will be found prior and resolution. Stages of fever. There are four stages of fever: prodrome, temperature rises, flush, and defervescence. First one is prodrome. Prodrome is a non-specific, compliance, mild headache, fatigue, general malaise, headache, and pains. Temperature rises. Generalized shaking with chills and feeling of being cold due to vasoconstriction. Skin is pale. Flush. A cutaneous vasodilation occurs and the skin becomes warm flushed. Defervences, initiating of sweating. Next, causes of fever: infection, vascular, neoplasm, immunological and rheumatologic, tissue destruction, metabolism, heart stroke, radiation sickness, etc. Unexplained. Infections lo viral, bacterial, fungal, parasitic, etc. Vascular, acute MI, pulmonary embolism. Immunological and rheumatologic, RF, scarcoids, IBD, RA, drug disease. Next, tissue destruction, hemolysis and surgery. Metabolic lo gout, unexplained lo PUO. Causes of fever. Fever is caused by an abnormality in body temperature regulation which results from an abnormality in the brain itself. Next, toxic substances that affects the temperature regulating center are endogenous pyrogenes. Endogenous pyrogenes released from WBC in response to infection, and exogenous pyrogenes from the body, like microbial products or toxins. Usefulness of fever. It has been suggested that fevers may be useful to some extent since they allow the body to reach high temperature where some pathogens with strict temperature uh, preferences can be hindered. Fever aids in most defense by increased proliferation of WBC, which help fight off the harmful pathogens and microbes that invade the body. Enhanced leukocyte phagocytosis, endotoxins effects decreases, increase in proliferation of T cells, enhanced activity or interferon. Clinical manifestations. Infections most common, cancer, heat exhaustion, autoimmune disorder and diseases, side effects of certain medications, overdressing అనేది with common with infants. Symptoms of fever, cough, runny nose, sore throat, diarrhea, and irritability. Treatment treatment offer plenty of fluids, give a lukewarm sponge bath, dress in lightweight breathable cloths, provide comfort, cover with light sheets, use fever reducing medications as recommended. Thank you.